Hello, my name is Dr. Noelle Lucas from Blue Oasis Pet Hospital, and I am here to help you better understand about your cat's vaccines. And I do have a little helper here for me to demonstrate or at least talk about your cat's vaccines and questions you might have. I also have an assistant here that's going to ask some of those questions that you might have about your cat.
So, Dr. Lucas, what are the core vaccine requirements for kittens?
So core vaccine requirements start when kittens are about 6 to 8 weeks of age. This little kid is a little bit too young for vaccines. This little guy is about 2 weeks of age, so we usually will start at about 6 to 8 weeks of age. Core vaccines would include feline viral rhinotracheitis, calici, and panleukopenia. We also call that an upper respiratory vaccine or an FVRCP vaccine. That's a core. And then we will give these little guys rabies vaccines starting at 12 weeks and older. And then the American Academy of Feline Practitioners recommends that we also vaccinate kittens for leukemia at a young age as well.
Okay, so what are the non-core vaccines for kittens?
So non-core vaccines would be, for example, like there is a Bordetella vaccine, there's an FIP vaccine, so some of those would be considered non-core. Core would be an FVRCP or upper respiratory vaccine. Rabies and leukemia would all be considered core.
How soon should my kitten be vaccinated?
So depending on the age of your kitten, most kittens are going to come in usually between 6 and 8 weeks of age, so that's when we start vaccinating them. If you have an older kitten, it depends if they've ever had a vaccine before, if we're going to booster that vaccine or start them on a new vaccine series.
What's the recommended vaccine schedule for kittens?
So the recommended vaccine schedule for kittens would be to start vaccinating them between the ages of 6 to 8 weeks of age. Then we repeat that vaccine core every 3 to 4 weeks until they're 16 to 20 weeks of age.
Does my kitten need vaccines if they're only going to stay indoors?
Yes, cats, even indoor cats or kittens, are going to be required to get vaccinated. Because we never know that their lifestyle may change. And we also do want to protect these guys from upper respiratory infections and rabies. And we know that you're going to have questions about that, especially if you have an indoor cat. So asking your veterinarian why the importance of vaccinating your indoor cat or why that is important is a conversation you need to have with your veterinarian.
Are there any risks or side effects associated with kitten vaccines?
So there are always risks of any medical procedure, especially if we're doing an injection. But the risks are low or rare, and the benefits outweigh the risks. So if you do have questions about vaccinating your cat, we really invite that you have that conversation with your veterinarian so that we can address some of those concerns that you might have, and we can also help you understand what risks are, what your cat's at risk for.
What if my kitten misses a vaccination?
So if your kitten misses a vaccination, don't worry. It's not that big of a deal. We just want to make sure that you get them back into the veterinary office so that we can booster that vaccine. Or if it's been a delayed period of time, we might even have to restart their vaccine series to protect them fully.
Can my kitten go outside if not all vaccinations have been given yet?
No, we don't want your cat to go outside if they have not been fully vaccinated because their risk for getting infectious disease would be higher because they have more exposure. So the way to protect them the best would be to limit their exposure to outside until they're fully vaccinated.
Why is it important to get my kitten vaccinated by a vet?
So the importance of having your cat vaccinated by a veterinarian is vaccines are actually a medical procedure. They are also often a modified live vaccine. They need to be kept at a specific refrigeration. They need to be administered properly, and your veterinarian and the team that support them are trained into how to properly administer vaccines and also the proper storage. Vaccines can be inactivated if they aren't stored properly or transported properly, and you might not be protecting your pet. If you have any questions about your cat's vaccines or kitten's protocol on how to vaccinate your cat, we really invite you to reach out to your veterinarian and talk to them about it, or call us here at Blue Oasis Pet Hospital. Thank you. He's kind